Last June, a brain tumour the size of a large apple was removed from Doreen Adams. She was one of the first people in the world to have it removed through her eyebrow.
And if it hadn't been the NHS asked me to go for an MRI, I wouldn't have known about it, and I presumed I wouldn't be here.
Surgeons have been able to remove small tumours through the eyebrow for years. It's believed that removing large tumours the same way had never been done before. The new approach has been developed in the northeast by neurosurgeon Dr. Anastasios Yamouriadis.
We can approach the actual tumour very quick, within probably 30-40 minutes, with a normal bifrontal approach that will take probably, even in experienced hands, in order to do it appropriately, probably a couple of hours.
Dr. Yamouriadis operated on Doreen after she underwent surgery for the same issue abroad. Unfortunately, they failed to remove the tumour and more surgery was needed.
That's the residual tumour, quite significant residual. That's the swelling of the brain.
The new procedure reduces the likelihood of side effects like going blind or suffering from a stroke. But the most extraordinary part is the recovery time. A bifrontal craniotomy, or the traditional way to this type of brain surgery, can leave patients in hospital for weeks, sometimes even months, including time in intensive care. But the modified eyebrow keyhole approach can have patients home within 2 days.
I was in the 1st of June, I was operated on the 1st of June, and that was like, I think I was in on the Thursday and I was home by the Saturday.
How did you feel on the Saturday?
Just fabulous. I was tired, that was the only thing, I was tired. My family were there, but 2 days.
Dr. Yamouriadis has committed his life to neurosurgery. His adaptation of the eyebrow keyhole approach, the thing he's most proud of.
It's the most rewarding first when you know the operation went well and the operation finishes, but it's especially that moment in recovery when the patient wakes up after a few minutes and the patient is fully awake, they can see again, they can talk to you. There's nothing more uplifting and rewarding.
So far, almost 50 people have been operated on in this way. At the moment, the surgery is only available here in Aberdeen, a world first for a place that already has a rich history of pioneering medical procedures. Finlay Jack, STV News.